everybody, this is Azar, Doctor of Physical Therapy. I'm back again. Today I want to start opening a subject which is a little different. We already went over the exercises for treatment of different body parts. And now I want to talk about some preventive exercises. You may ask yourself, what's preventive exercises? That's correct, they exist. They actually can be very good and useful exercises for everybody, especially kids. You can investigate, take a look at yourself, take a look at the family members, especially the kids in the family, to make sure if they have any malalignment that can cause later on the issue, then you can fix it before it gets later and they start having pain. You might not even have any problem in the kids might not even report any pain because imagine, they're just starting. They are very, very fresh, and even they have malalignment, they're not gonna hurt. Imagine a car that has not been driven for a long time, so it's like it's a new car, brand new car, even if it has malalignment, it's not gonna cause any wear and tear in the tires, right? Because it's too early. So for the kids, the same thing. Kids are very fresh. If we recognize and diagnose the malalignment before they start having pain, we can prevent a lot of things. First subject that I want to talk about is preventive care on by looking at the alignment of the lower extremity. Lower extremity covers the whole leg from the hip, knee, and ankle. So I'm going to show myself some of the malalignments that I actually have also, and your kids might have it, and you might want to look at it carefully and investigate to find out. So first thing you want to notice and look at is we have two prominent bones right here. I can show you with putting my shirt up a little bit. So you see that two bony prominent of the pelvis. We call it ASIS, which is anterior superior iliac spine. They have to be aligned both sides when the kid or adult standing upright. So in my case, because I already all know my malalignment, the right ASIS in me is a little higher than the left. Yes. You can see that if you really investigate carefully. Some of you may not even notice that. Sometimes when we exercise, we can make it less noticeable. So it can have actually different problems. The kids with that problem can have different issues. The first thing that this kid might have is a scoliosis. If the kid has a scoliosis, then they have problems in the spine, and the spine is, instead of being straight, looking at the back. For example, you're looking at my spine, it has to go all the way straight down, right? If it goes to one side like this, or to the other side like that, instead of going straight, so we have a convexity in this side, or we have a convexity in this side, so we're gonna have a scoliosis. That scoliosis can cause problems down to the lower extremity and legs, even though the leg might not be, in terms of the length, it might not be the difference between both legs, but a scoliosis can cause like noticeable difference in the pelvis. One pelvis can go up higher, and then that can cause pseudo leg-leg discrepancy, which sometimes is not a real leg-leg discrepancy. So both of the legs, they have the same length, but they look different. So people look like a little bit crooked on the pelvis. If that's the case, if it's coming from the scoliosis, we have to make sure we take the kid to the spine doctor. It's very, very important, because when the kids are growing, the spine can get a little bit of the shift in one side or other, maybe in the thoracic spine, the mid spine, lower spine, or even on the neck. So either one can cause problems. Sometimes the scoliosis can be double in one in the neck or in the thoracic. Sometimes it could be in the neck, thoracic, and lower. We can have up to 3 scoliosis in one person, or it can be like having the kind of spiral spine instead of the straight spine, or we can have a convex spine, or we can have a concave spine. So they all can happen. Depending on which scoliosis we have, which we don't want to go to the detail, this person or this kid can have a pseudo leg discrepancy again, so the pelvis can get a little bit of the shift. One side of pelvis can look higher than the other side, and whatever exercise you do for the leg and lower extremity, and even with the inserts that they try to put in one side of the leg, then one side of the shoe, we can have an extra insert, which we're gonna talk about it. Even though we do all of this, we still have issues. We don't really fix the source of issue, which is the scoliosis or spine problem. So we really want to take the kids to the X-ray place. First of all, to the orthopedist. Orthopedists probably recommend the X-ray, and X-ray will show if the patient has scoliosis, which is crooked spine, and how many degrees that scoliosis is. And if that degree is higher than 30, we usually really want to focus on taking the patient for bracing, or even surgery, or something that can really fix the problem. It shows that it's really severe. And unfortunately, when the kids get taller and taller and taller, which is usually the growth plates are open until age of 18, by that age we can still have growing of that scoliosis and making it worse and worse, and that angle can actually increase. So if we have a very younger kid with a scoliosis, we should be more worried than if we have a older kid with a scoliosis, because older kid with scoliosis probably for the most part finish the growing part, and the growth plates are almost closing, so we're not worried about increasing the level of a scoliosis and degree of a scoliosis. But for the small kid, because we have a lot of years to go, so we obviously have to be more careful about taking it seriously, and taking the patient to the orthopedist, and as soon as possible giving physical therapy, bracing, or even surgery. So usually it starts with physical therapy, and I already went over some scoliosis exercises. I'm not sure if you remember that or not, but you really wanna look for this. So if the pelvis, when the patient stand in the level place, if the level of pelvis is a little uneven, it could be from scoliosis. So, and other things that can show us scoliosis is very obvious. So looking at the shoulders, which shoulder is higher than the other one? Usually if we have very tight muscle in one side, which people are on the computer or right-handed, are working on the right hand or carrying the backpack in the one side, we usually have a little bit of the higher shoulder in this side, because this shoulder is always trying to take the weight and get itself ready with the upper trapezius muscle. This big guy is here. So we can really expect that, but more than certain amount of having one side of the shoulder higher than the other side is a red flag. So if we have one shoulder is very higher than the other side, take it seriously. Take your kids to the doctor. Don't panic, but take it seriously. So again, these two are indication of scoliosis in the kids, two most important ones. Of course, if you have a good eye, you can look for other things. Sometimes if you're looking at the back of the kid, you can see that shoulder blades are, this side is a little higher. So if you can follow the shoulder blade in the kids that are a little bit thinner, you can follow those, and you can see the end of that shoulder blade, one side can be higher. You can also look for the creases, like that we have creases there. I have to show you this way. So we have creases here, and these creases are uneven. So sometimes we can see one part of the crease of the back is deeper than the other side. That's indication that if one side is deeper, we have probably concavity of the spine on that side, which that side of spine is really getting compressed. So we have to be careful about that, and we have to treat that. So another things that can show us that the person has a scoliosis is when you're looking at the person and you feel they are kind of rotated. So if they are rotated on one side more than the other side, so that if that could be the indication of a scoliosis. We usually can look at the patient from the top, and then look at these two shoulder, top part of the shoulder, and then you can put your hand like, or a ruler there, and then if you feel that instead of being this way, between both shoulders should be this way, if you have an angle, So basically we are like this or we are like that. It shows that we have a scoliosis that is a rotatory form. Usually rotatory form of a scoliosis can put pressure more on the rib cage. Also the side bend can put pressure on one side of the rib cage. If it's really severe, patient can have shortness of breath and other really serious issues. So we want to look for those. And then another thing that we can that can really help us is just looking at the patient and really look for any unevenness that you can really see, any kind of unevenness. And we have actually a test for scoliosis too. If you really want to have a professional test, I'm here to show that to you also. So that's the Adams test. So looking at the patient that's bending from the backwards, you have to be on the back of the patient, like almost like 10 feet away from the patient. Looking at the patient, when they bend forward, they have to bend all the way as much as they can. And when they're trying to back up, you might see one side of the rib is humping up. That usually means that if they have a hump, when they're coming up, that usually means that that's the rotatory part of the spine. So the spine is kind of rotated, so one side gets humped up. It's like basically, how do you call it? The humps that you can see in a camel. So one side of the back can get that hump. So, sometimes not too obvious, but if it's really severe, that would be really obvious. So that's one more test for scoliosis. Again, don't panic, but look for those. Look for those because your kids are in the growing age and they deserve the good preventive care. And if they have something that we can prevent early, of course we want to do that. As the parents, I'm sure you all want to do those. So that's all about the scoliosis preventive care, and not the preventive care actually, how to recognize first the scoliosis. I'm going to talk about the preventive care in the next video, because today I went over more of a how to recognize if your kid has a scoliosis or not. Hopefully that's helpful for you. That's it for today. If you like my videos, you of course can subscribe to my channel, and you can refer me to your friends that need that. And then hopefully we can go over some preventive care for scoliosis if we have a mild scoliosis in the kid, and how we can take care of it without the surgery. We try to go over that in the next video, and then after that we're going to go to the next malalignment that's very common in the kids. And especially adults. The reason that I'm saying the kids, again, because the kids are more important in terms of preventing from getting worse in the future, because they have a lot of years in front of them, and then of course they have more ability to prevent and then correct the malalignment, because their body is more flexible and they can really fix things even if we catch them early though. Thank you so much and have a great day. Bye bye.